ARP, and there is a whole group of data, whole group of information, and if nothing else, some fun. So go check out ARP online. But for me, I'm having a great time. We want you to understand that you need to increase, or should increase, your health IQ each and every day. Learn a little bit more so that you can stay around. Don't want to be light, but it's COVID, so I don't want to be boring either. So I'm your host, Munson Steed. Dr. Ugo is definitely, he was with us this morning, and we really appreciate all the things that you're doing to help us. So if you are having a stomach cramp, or you have yet and saw that your mood has changed and you're not going to the bathroom as regular, as often as possible, or you have a lot of gas, you might want to give him a call, look him up on Instagram. But at any rate, then there is the intellectual capacity, who flies between Florida and Martha's Vineyard. And we have Dr. Taylor, who is going to share with us insights. This is all about mental health. And then if you haven't heard about Henry Ford, then you probably want to at least look up Henry Health. And Kevin there does a wonderful job in saving lives and at least allowing us to take a picture of ourselves. If you're wondering why we are light on health IQ, because life is heavy. And for all of you who haven't read the first, sentence in Scott Peck's A Road Less Traveled, it says life is difficult from the start. So maybe we'll start there, because for anybody who doesn't understand that sentence, they have removed themselves from the possibility of beginning to deal with their own mental health. So, Dr. Taylor, we are here for men's mental health. And yes, life is difficult from the start. God knows. Add on racism, add on COVID, and we feel like we are weightlifters. We need to be superhuman. And still, the bullets did not save George Floyd, for sure. Rest in peace. So it's stressful. If we see blue lights, it's stressful. If we see blue uniforms, it's stressful. And if we just actually walk outside our neighborhood, we're already stressful, depending on what neighborhood you walk into. Help us to cope, Dr. Taylor.
Well, I like that you started with Scott Peck, because it's true. Life is hard from the start. And I think the earlier that, speaking for Black men and boys, that they realize that it can be a positive, and not that life is insurmountable, but as a Black person in America, and certainly as a person of color and as a male, there will be judgments made against you strictly because you are Black, strictly because of the color of your skin. There will be assumptions about your intellect that we know are wrong. There'll be assumptions about how you grew up that are wrong. And so there is this constant need to overcome it before you recognize exactly what the enemy is. And so part of life is understanding and getting a self-identity that reflects our history, our strengths, the expectations that we have, and certainly knowing that no matter what situation you were born into, you can always overcome. It's difficult, as you mentioned, when there are blue lights, when you are pulled over or beaten or worst case shot just because of the color of your skin. And we know Dr. David Williams from Harvard has taught us that when an unarmed Black man is killed and people see it, whether it's on TV or on your phone, it impacts a whole community of Black people. White people are not as impacted. And so part of what you were saying, and I think we're talking about, is protecting your mental health means also looking at what you're exposed to and not looking at the same images over and over. But at the end of the day, and I think Henry Health is brilliant. I'm so glad Kevin's on here. But at the end of the day, we have to understand how everything impacts our mental health. One of the demographics you left off in your introduction was women and relationships, knowing that the first relationship usually that men and boys have is with their mother, and then how that carries on to other relationships. So there's a host of things that we can talk about, but I'm glad you're highlighting mental health, especially in Black men, because as the World Health Organization says to us, there is no physical health without mental health. So Black men have to focus on your mental health. So thank you.
Well, I didn't leave any women out on the introduction. You know, sometimes it's just about us. And, you know, peace, mom. My mom's watching, and I just wanted to shout her out just so that you know I love all the ladies and understand it. You know, Taraji got it right. Do not call you super women. And the only reason you're here is because we wanted to make sure that there was a woman present and we could really have that voice. So your brother's over here just messing with you. Like I said, it's COVID. This is when I actually get all my guests, just in case anybody wonders about social profile. Zoom is how I actually have guests into my home. So I'm Zooming right now. So welcome everybody and thank you, sister. I definitely want to never leave out any women as it relates to our mental health. So you're 100% correct, Doc. Henry Health, Kevin, Black men, life is difficult from the start.
Yeah, well, first of all, Munson, thank you. And thank you for inviting me into your home, into your living room. You're also invited into my parlor. I'm sitting in my parlor in Washington, D.C. So it's good to be here with all of you all this evening. Life is difficult from the start. There are so many things that Dr. Taylor said that really resonated with me. One of the things I think that this night gives us the opportunity to talk about that we've not really, I've not seen a lot of conversation the last couple of weeks, and that is the impact of the pandemic and then the death of George Floyd and what that has meant for not just the mental health of Black men, but for the mental health of Black people. In fact, the early reports report that upwards of 40% of African Americans are reporting experiencing depression and anxiety. And we know this to be very significant because in the past, Black folk have not even been willing to admit that they were depressed or suffering from anxiety because, quote, we saw that as being crazy. So we're really seeing a shift in the culture around how we talk about mental health, which number one, I believe is a tremendously good thing. And I think that comes from the work, as you mentioned, of people like Taraji Henson, who've been raising and lifting up this ideal of mental health and how important it is to our health. But, we are at, I think, what could literally be a crisis in our mental health in Black America. And, Dr. Taylor referred to the work of Dr. Williams, which I think is really powerful. And at some point, all of these sort of killings on television and just even the general awareness in the news, it does take a toll on us. And for Black men in particular, I'll just try to bring the conversation back to Black men. We know this to be true. It plays out with Black men having the lowest life expectancy of any population. Just a few days ago, I had an intimate fireside chat with Dr. Sherman James. And for those of you who do not know Dr. James, he is the originator of the John Henryism hypothesis. Essentially, the John Henryism hypothesis his research proves that the social logical pressures associated with being a Black man increase poor health outcomes and cardiovascular health. Is based on the American folktale of the story of John Henry, who was the steel driving man, worked on the railroad, known for his power and his strength, and was ultimately challenged to this competition with the steam powered hammer. He beat the hammer and later died from a heart attack and stress. And the truth is that is the story of Black men. That is what is happening to us on a day-to-day basis in America. The good news about where we are right now, we're having a very honest conversation in public health and in mental health about what systemic oppression and racism does to our health. And because we have my sister, Dr. Taylor here, I should just mention that in addition to the John Henryism hypothesis, there's also convincing and compelling literature around the superwoman schema. So Taraji Henson said, don't call yourself a superwoman, right? But the truth is that the data shows, like there's published journal articles on the superwoman schema, which shows essentially proves the same argument that we see play out for Black men in our health. We see that play out for Black women. And so now we're at this place, Munson, that we have to be very honest. We can have this conversation with payers, insurers, hospital systems. Why is it that Black women, in spite of their having higher education, higher income, have more premature birth than any other group of women, right? So I think we're at this really important place that we can have these very honest conversations and put forward some very bold solutions that we've never really considered before.
That's my long pause, just in case y'all didn't get it.
I was wondering if you wanted more, because I certainly got more, but I was trying to leave it there.
No, that was my long pause. You know, when you're here, you kind of pause and kind of let everybody digest. You know, hit them pretty hard. You know, you hit them with the John Henryisms, and you know they got to take that away. For all of you who are listening, we want you to write some of this down so you can do your own research or go to ARP and at least understand or follow the individuals that you see here and delete some of the people that are giving you some pictures that are not lifting up your mental health or giving you good information. Because I think that is a real tragedy in our community. We are following and feeding ourselves information that is empty. And so it leaves you very empty, and yet you're supposed to be thrilled. And we're following people by the millions, and people are posting the 10,000 times hoping to achieve self-value, and literally are getting no peanuts for that trick. So Dr. Hugo, why don't you share with us, you know, life is difficult from the start.
Life is difficult from the start. Sometimes the question is for African Americans, is life difficult from the start just because of our genes? Are we just essentially genetically cursed? Is that the reason why we have worse outcomes prenatally? Is that the reason why we have earlier cancers, more aggressive cancers, higher mortality from the cancers? And I think the answer we're finding out is that it's not race that's the problem, it's racism often. That's the issue. And a lot of the outcomes, health outcomes that we see. You can have an institution full of good people. It doesn't mean that that institution does not have institutionalized racism. There's certain behaviors that are just passed down from generation to generation, ways that one person can be treated that are just different from others. And so if there's a culture of disregarding someone who, let's say, doesn't speak the language, might be Spanish only speaking, that can be very subtly handed down from doctor to doctor to doctor, let's say in a hospital, and to a point where no one actually has to say the word, but just it's caught early on that you get to do X, Y, or Z. In this situation, if someone doesn't speak the language, well, you can just kind of do a quicker exam and move along. And so, you know, a lot of that institutionalized racism exists. There might be good people, but there's a lot more good work that needs to be done. And so I'm really excited to be here on this panel with this brilliant Black excellence in front of me. Dr. Janet, Dr. Kevin, I call you Dr. Kevin, I'm still gonna call you Dr. Kevin. And you, Munson, a man of many talents. So I'm excited to hear myself where our conversation today is gonna go.
I don't know, Doc. Thank you so much. I'm all about Black excellence. I mean, at this moment, I think America is awakening up to lots of Black excellence, but I think the excellence is now being heard. You know, I still have a problem, and Dr. Taylor, I really need your help when you're on Martha's Vineyard. I have a problem with the level of telling all your business.
I know.
Everything. I have a problem with them having Black pundits who don't have degrees, don't run companies, don't serve our community, and yet they're the face. You know, I love my brothers over there with those 3 initials at that news channel, and I don't want to keep assuming that, you know, you're trying to pit me against the Indians, but I need to see a Black doctor. Mm-hmm. And so I think when we talk about racism, even the images of doctors that are put out in front of the public, and there are a lot of discussions by people that have not studied, cannot prescribe, are not providing, have not built a health system at all. And I think that this PST PTD. What is it, Dr.
PTSD.
Yeah, I'm trying to keep
Post-traumatic
that word
stress
out.
disorder.
Yeah, I think that our community is suffering because even the pundits who are prescribing and talking about COVID, they're never going to be in front of them. And they always advocate for not a Black agenda. And right now, we need a very Black agenda to talk about how to help Black people, from people who we don't have to wonder what your lens is focused on. So with those initials, what did you say it was again, Doc?
PTSD.
PTSD.
PTSD, post-traumatic stress disorder. But here's the thing, Munson, for 400 years in America, we have not had a Black agenda. And so now is the time when it's not just us who are saying we need to have a Black agenda, but we need to recognize we built this country 400 years ago. It was us. And you know, from unpaid labor to policies like the Black codes to policy like Jim Crow laws. I mean, nothing has really changed for us that much if you look at the wealth gap. So not only do we need to have pundits that look like us, we need to systematically break down all the institutions like Dr. Ugo was talking about that contribute to the unfairness in this country, that contribute to the two pandemics where the intersectionality of being Black and being an essential worker, of being Black and turned away from COVID, from your own hospital where you work, being Black who got a respirator, to all of those factors of being Black and not being able to work from home. So there are so many factors which have contributed to where we are today. And so it's not just about getting our information from TV. We need to learn our history and find our own facts, find our own sources of the information that we need, because we cannot count on white America to give it to us.
Well, that's why we're on Health IQ.
Exactly.
Right now.
That's right.
And we appreciate it, and that's why I could go inside my community.
And Munson, can I build there from what just Dr. Taylor just said? I think, you know, when we think about this conversation about men's mental health, one of the things that I've been saying to payers and hospital systems the last couple of weeks is that it's time to face this hard truth that mental health care was not designed for everyone. And in fact, in our country, when we look at like clinical theory and the research that drives our learnings and how we treat mental health, that research is often based on research from middle-class white families who have experienced one trauma. And so when we think about the experience that African Americans are having in this country, and even marginalized populations, people from, you know, for example, the LGBTQ community, we know at face value that how we have sort of approached taking care of these patients in our mental health system, that's not sufficient if we don't honor culture. And so, you know, when we think about the work that I think we have the opportunity to do now, we should be asking ourselves a question: why for every 20 therapists in the country right now, we only have one Black therapist? And Blacks are 20% more likely to have mental health issues than the general population. So I think, you know, being honest about these sort of issues and taking, you know, making bold recommendations about how do we change this and improve the systems is the opportunity we have right now.
It's my long pause.
I always get these pauses after I talk.
You know, my wife says, don't be a moderator that overtalks the speaker. So clearly for Dr. Ugo, our diet, you know, the intake, it starts with how we eat, how we feel and how we eat. How do they play a role? Because that's your specialty.
Right, yeah. So, you know, it's one of those scenarios where we have these foods that we grew up eating and that we've come to know and love. And I think it's time that we have to be honest with the fact that that can't be our daily staple. It does not work. We eat too much fried foods. We eat too much red meat. We don't eat enough fruits and vegetables. And there have been estimates that essentially a third of all human disease ultimately can be boiled down to our dietary choices. Sometimes people try to circumvent it and do things like taking laxatives or supplements to kind of fix the foods they've already eaten. But if you've already eaten it, it doesn't matter what laxative or supplement or vitamin or mineral you chase down with it. You know, we have to start with what's in front of us on our plate. And so, as I like to say, it's always hard to take a thing away from a person, but if you give them something, it might make them less willing to reach for the thing they don't need. And so the way we like to think of it is that if you have a plate in front of you, half of it should have fruits and vegetables. You can go crazy with it. All the fruits you like, vegetables you like, and that will automatically just fill you up. It absorbs the water, keeps it in your system, and makes you less likely to eat things that have cholesterols that are bad for you, less likely to consume things that are high in glucose if you don't need to be on that, less likely to have you eat things that are high in sodium that can raise your blood pressure. And so we need to develop a culture, really, and maybe we need geniuses like you, Munson, on this to kind of rewrite what is normative in terms of the Black American diet, or the American diet, really. We need to have new normals in terms of fruits, vegetables, healthy things on our plate that we identify with and that we look for routinely.
I appreciate the compliment about being a genius, but he was really talking about playfulgenius.co, my children's book site and toy site. When he was referring to genius, I have no desire I like to be around geniuses like yourself, Doc, and he is always so polite. But this is a Black agenda, and we have to say it. And I'm encouraged because Doc is polite. We actually hung out this morning. But if you don't eat fruits and vegetables all day long, you are killing yourself. We need to put it out there. You should not go to a church that offers fried chicken at the end of a funeral. I mean, that is a problem, and we all have to say it loud. I think we're all practicing as a community, and I don't know, you know, I'm not in the healthcare profession. I love my community, but our health KPIs are still not coming out of COVID. No one, and literally Kevin and I talked about it. You know, everybody's getting the COVID 20 and the COVID 15. Like he said, freshman year, you put on 15. Well, I think Dr. Ian said this is all about reset. If you're not striving for your high school weight, you're striving for the cemetery. Got to make a decision. Not wearing a mask, you're striving toward the cemetery. We got to make a decision. So, you know, I know you're working on your book about diet and the Black diet. I know that you're doing that. I know that that's the book coming out with you, you know, and so everybody needs to look out in February of next year. He has a book coming out on the Black diet, which talks and breaks down the whole, you know, channeling of food as it relates to emotions and how it actually produces internal disease. Because my community needs to understand what glucose is. And there's a new tracking of conversation. But for all of us who are literally suffering, why don't men, and please hit me with some KPIs, key performance indicators, because, you know, I forget that PTSD, but I know you were going to tell me what it is. So I'm counting on you, sister, you know. But I really want to know some new insights on why Black men are not going to the doctor on a regular basis and why other Black men are allowing them not to go. We'll start with Dr. Jen.
Okay, so I mean, we started this off talking about how life, you know, the start's not fair. I think we have to talk about the role of stress and chronic stress as that relates to anxiety and depression, as that relates to the choices that we make. And we know when people are depressed, they're less likely to go to the doctor. And the other is, I think, as Dr. Ugo was saying, we have to change our mentality about what it means to be healthy. Now, part of that is in America, healthcare is a business, and healthcare doesn't, certainly there's money made in prevention, but we haven't always said, like, be the healthiest, because when you get paid for insurance, even though they're starting to change reimbursement for having a disease state. So too often we don't think about what'll make us better. I know for Black women, I don't know the stats on men, but Black women will present to their healthcare provider 10 times before they're asked if they're depressed or not. We have to change that, which means we have to teach individual Black men to know what they feel like when they're stressed, to know what they feel like when they're depressed, to know what they feel like when they're angry, when they're frustrated, which means as a community, and specifically as Black women, when our men tell us they're in pain and they're stressed, and our little boys tell us they're in pain and stress, we can't say to them, you know, man up, or boys don't cry. We need to allow them to have the emotions that drive them to want to go see a therapist or want to go see a doctor. Most of my patients who are Black men, I mean, I've worked at Rikers, I've worked with people who are criminal justice involved, are seeing me not because they want to, but because either their employer or their spouse or partner, somebody said you have to go see somebody. We have to change that so that the KPI for individual Black men is they know they don't feel well, and not well physically. They may not feel well mentally, and they're going to go take care of themselves, which means lose the stigma, lose the shame, figure out, go to Henry Health and figure out that what they need to do, so that then when they go in, the same way that people line up to buy Jordan shoes, you line up to go and get your mental health checked out. We have to make it okay to do that and not shame men because they feel a certain way or because they feel it all.
Well, we were real close. You did almost close job on that. I really, you my sister, so I'm sorry we've known each other for 20 years now, and I just want people to know, I need men to identify 7 emotions. I need you to have 7 emotions that you can tell me how you feel, because you know what? If you can't identify at least 7, don't talk to me. You're not trying hard. You're not working hard enough on yourself. I need 7.
I think that needs to be your next book.
That's right.
I got 8 out right now, so I'm good. And I got a new women's meditation book coming out during COVID called Peace and Purpose. But I need, when we say KPIs and we talk about a healing, I want men to be able to describe and speak in an emotional language.
Yeah, Munson, I think really, kind of to build on Dr. Taylor's point, I think, I like to use my own example as really the story of what's happening with Black men, and how I even came to work in mental health. I have a public health background, and I was busy growing my consultant practice and worked myself into mental exhaustion. And that mental exhaustion led to depression. And my experience is not unique. In fact, after that, I started talking to my friends and realized that many of my friends had did the same thing. And so, we all saw these signals that we were losing our emotional footing. But, our culture says to us, man up, keep pushing, be tough, be strong. And so, although, we could feel that and me personally, I felt, like I'm losing my center, I still had these expectations from my family, my friends, and society that, I'm supposed to be able to solve all the problems, and I wouldn't take the break and the space that I needed to recalibrate. And so that experience for me is very common for Black men. And then to go a step further, when we do find ourselves in depression, what we know, and the doctors are here, they can reinforce this, depression for Black men shows up in ways that it doesn't show up for any other population. We become agitated, irritated. And so, this whole concept of us being like the angry Black man and so forth, where he actually might be depressed, right? Because depression manifests in us in ways that it does not manifest in other populations. So I think, part of this, setting the KPI is first, we have to do some education work about what it means to be mentally healthy. There's nobody gets an award, should get an award for sleeping 4 hours a day and working 15 hours. That's not what the human body is designed for. But we grew up in this culture where we're told we should be twice as good as white folk. That's insane. That's an insane idea. I push back on that with my children. Like what we should be teaching our kids is to give their best, not that we have to be twice as good and so forth. So I believe that these types of narratives sort of further contribute to the detrimental position of Black men's mental health. And the silence again.
Okay, I'm coming for you in a second, but because we still missing, and we only got a half hour more. Dr. Ugo, I'm gonna let you get 4 minutes on that conversation. I'm coming back at Kevin because I love it, Kevin. You just keep sharing. I'm gonna know you real good. Can't wait.
Yeah, so I think you mentioned feeling emotions. I think one of the emotions that keeps Black men away from seeing their doctors is fear. Fear of what the diagnosis is going to be. There's a lot of stigma with psychiatric illnesses. We see it portrayed in always negative ways in our stories that we tell ourselves through our books and through our films. And so fear of being identified as that person, that keeps people away. They don't want to feel that. I think another emotion that keeps people away from seeing their doctors is embarrassment. There was a study done from Cleveland Clinic that found 46% of men who reported they don't go to see the doctor sometimes just because they're embarrassed to talk about the issue. Sometimes it's psychiatric and sometimes it's bodily. Their prostate, their bowels, the gassiness that you mentioned earlier. There are a lot of symptoms people have that kind of keep them away from seeing the doctor, and it doesn't need to. And I think another important emotion or concept that keeps people away is that concept that they are not Superman, just that sense of mortality. And the same study showed that 41% of men don't like that sense that they can be reminded that life is fleeting, that they're not here forever. And so they'd rather just ignore it, push it away so that they can continue to maintain the facade of being impenetrable, but none of us are.
When you think about my language, because see, 7 is real important for me, Kevin. I'm really sincere when I say that. It's kind of like I would tell all my, Black women go to Al-Anon, go to Black men, pick one, NA or AA, and you're gonna have to find somebody you can talk to because go find a stranger in a 12-step group so that you're not alone and you can at least begin to evaluate your perspective on life from beginning to end to know that you're okay. Because we're so bottomed out that I don't have somebody to say, I am really hurt by what happened at my job. I'm embarrassed the fact that they didn't pick me for the promotion. And the fact that my wife now makes more money than me and can tell me something, I'm so angry about that when she talked to me the way she did, I felt like I wanted to do something that I never wanted to think about, but I was hurting inside. And the fact that she said it, I'm gonna never forget it. Now, when you have conversations and then you add what your mama said about your dad, all of a sudden I got this whole complicated history that keeps following me with even women in my life that have offended me in ways, but I had to love them in spite of. So I began to hate myself a little bit because I was fearful of expressing how I honestly felt, because she repeated it back to me after that about 250 times. And so not only am I depressed, I'm angry, I'm lonely and feeling that I'm the only Black man that feels this way in America. And I still don't see who I am when I listen to television or read a magazine, and they already tell me that I'm redlined against. So I'm depressed even more because in my loneliness, I feel like I'm sorry and that there's something wrong with me and that there's no fix it. And so even when I show up at the doctor, he wants to give me a pill and I just really want to be fixed. I really don't want to be broken, but I feel broken, but I don't know how to say that I feel broken. And emotionally, I'm angry I'm depressed, I feel lonely, I feel let down, and I feel like I'm being attacked from all forces, from my finances, my love life, the community, and people like Jay-Z more than they like me. And he ain't never gave him a health IQ. Just a few emotions, Doc. You know, if we can't say how it is, how are you gonna feel when you get to your first PSA and, I have a female physician, so she has to put her index finger in my rectum. And I have to still know that I'm a man because she put her finger in my rectum. I mean, it's a real conversation. And to tell a brother, you need to look forward to that. And that will save your life. And you have to have people in your life that say, don't fear the test. And know the history of the test. That's a huge emotion. So Kevin needs some help, because if we can't tell the doctor how we emotionally feel, it's a problem. And that doesn't even start to talk about chlamydia and any other disease that men are spreading and can't talk about it, don't have a solution, and we hope it's jockey itch, but we know it's not. Kevin?
Yeah, Munson, we just got a question that came over the chat with someone asking, how do you find a culturally competent mental health therapist? I can certainly give some thoughts to it if others want to as well.
No, I want you to give me my 7 languages, and I definitely want you to answer that question, because we don't in need. But we're gonna leave here with brothers who are suffering, or their family members being able to really have emotional conversations, because I don't want to keep hearing conversations that you mentally broken, and yet you can't define to you, and I can't confide in your stress. As an entrepreneur, I get it. I understand exactly what you're saying. 5 airplanes a week and want the payoff, and the payoff ain't never big enough. So definitely answer the question, my brother. I'm with you.
Yeah, so the person asked this question about a culturally competent therapist. I think this is really a real significant issue. In fact, we know that the data tells us that 50% of African Americans terminate therapy prematurely because of provider fit. So the experience that I had in seeing 3 therapists before I found a therapist who worked is not uncommon. That that's half of the people who even engage in therapy find themselves in that situation. So I think this is a really difficult question, because the other data point is, and I mentioned this earlier, less than 4% of the therapists in the country are people of color, and there's nothing about their training that trains them to prepare us. So the therapists I found that worked for me, I actually heard a couple talking about how good he was for their marriage, right? And so, at Henry Health, I should just mention we're providing therapy in DC, Maryland, and Virginia. So certainly the person who asked that question, I can guarantee you a culturally competent therapist if you live in that area. But I would say that, your recommendations, the best way to find a culturally competent therapist is through your social network in these other places. Like, find someone, the couple that told me about Tony Spann, who today is our chief clinical officer, they didn't even know that I was looking for a therapist, but they were just talking about how amazing this therapist was with their marriage and how he had helped them get their marriage on the right track. So I would say it's really important that we, in our circles, we talk more openly about mental health. And if you've had a therapist who works, tell people about him or her. So that's my answer to that. I'll leave it there, Munson.
Can I add, and then I want to get back to your point, Munson. Yes, and cultural competence doesn't just mean that they are the same color as you or the same gender or even the same sexual orientation. They need to be competent in what they do. They need to be able to listen to you, and so that you feel that you are getting what you came for. And sometimes it is a good fit, but depending on where you live, you may not have the luxury of having someone who looks like you. But now, certainly with telemedicine, you can find that. But understanding, like when you're going to talk, it may be uncomfortable, and just not to put that on the therapist, but understand the therapist can tolerate it and try to stick it out a couple of sessions if it works, so that you don't lose that ability. But Munson, I think everything you said captured so much about what I see in Black men in terms of the trauma that they've had that they've never talked about. And trauma doesn't have to be like full on, you were in the towers when they fell. I'm talking about sexual trauma. It could be sexual abuse. It could be physical abuse. It could be neglect. It could be watching your parents' relationship, and then how that plays out in different relationships that we have. And so again, we mentioned depression. If you feel depressed and it lasts longer than 2 weeks, or you feel like you don't have the same interest in your usual things that you like to do in terms of sex, not sleeping, not going to work, or if you find that you're coping in negative ways, too much alcohol, smoking weed, spending money, you don't have all those things, then you may be depressed. And you don't have to see a psychiatrist. You can start with your healthcare provider, which could be a nurse practitioner, which could be your primary care doc, but just be willing to talk about how you're feeling. But everything that Munson said about and not just, maybe this is my point I can play on the panel. I think as Black women with our Black men, we have to learn to fight fair, which means not bringing up when they say something about how they feel, or a weakness or a fear, we can't throw that in their face for our benefit. It doesn't help our relationship, and it doesn't help them. So I think we have to deal with our own issues, and then realize, as Munson said, the importance of a healthy relationship, which is not just about what you can acquire, but how you treat each other and how you support each other and how we stand up for each other. Because, as a Black woman, I can say, certainly I've had my share of pain, but wearing like the bullseye that our Black men wear every single day when they walk up and go to work and just on the street, and just what they have to deal with, I think is something that you would only understand probably if you were a Black young man or a Black man. So I think it's a matter of, as women, we have to support our men and listen to them and try to engage them emotionally. And then Black men have to trust us enough to let us know how they are feeling. And, as you mentioned, Kevin, if it doesn't work, like, go to couples therapy, talk to someone. But, we have to get back to how we can respect each other again, have realistic ideas about how the relationship should be, and listen in a way that it's not ammunition to condemn, but how we can continue to support each other.
Thank you for listening, Dr. Taylor. I appreciate it. Dr. Hugo?
I think, Munson, I really feel like that soliloquy was powerful. It's not a voice I don't think we've even gotten to yet. I think that's really future-facing, forward-facing, where we're just now getting to the point where I think as a Black community, we're understanding that we deal with anxiety, we deal with depression, we deal with bipolar disease. In essentially our heroes, Kanye West is an example, who has admitted he has this issue, but we're not yet at the point where we're going to talking about emotions. And I think most men are raised to feel emotions are things you just put in a like a little closet and just lock up and just move along. You have to be tough. You can't let them see you cry. You have to keep going. And so I think that definitely is an idea of where we should ultimately go to. Because in the meantime, a lot of these suppressed feelings are manifesting what I see in physical ways. People come in with severe abdominal pain, and they're sure it's their appendix, they're sure it's their gallbladder, they're sure there's an ulcer. And you check and you check and you do tests and blood work and look with the scope, and everything turns out normal. And then, they come back from vacation and they mention, while I was away, I felt great. But the second I came back in my case to New York City, the pain came back, and that starts to give you a sense that there might be something else going on, some suppression of emotion that's manifesting in different ways. So we see people with severe headaches, chest pain, abdominal pain, change in their bowel habits. They're chasing it with medications, which lead to other side effects. But oftentimes, I think it does come back to processing of emotions. And, I know that Western medicine, as it currently exists, doesn't fully address it beyond what our brothers and sisters in the psychiatric sphere are doing.
I just say something. To me, Kanye would be more of a hero if he would talk about treatment, because bipolar disorder, depression, schizophrenia, schizoaffective disorder, they're treatable, and people don't have to suffer through them. They can get treatment.
He's also, he has a heroic posture to which we hold him, just, the history and the role he's played in telling our stories over time. But he's also the victim of the disease too. And so one principle is you have to be careful about blaming the victim, especially when there are enablers around them who might have alternative agendas. He has not met, apparently, a good scenario where he feels comfortable in going forth with treatment, as he said publicly. And so this is really a tragedy to one of our characters that we're watching in real time. And of course, we all hope and wish the best for him as he publicly, unfortunately, in the very public sphere, works out his mental health issues.
Kevin, you can see the question about stress management for Black men. What's it look like? And obviously, there's a part 2 down there where they want to know, what's the role of the church, basically, the narrative, the solution to educating Blacks in mental health. Is it the church?
Yeah. Munson, I actually want to back up to your soliloquy and share my thoughts. I actually thought that when you were going through it, you were talking about me. It sort of sounded like my script, but I think it's the script of every Black man. Like, this is our experience. And I think the tension I'm having around articulating the emotions as you want them is, I don't know that we have had an invitation to be very honest about this before the death of George Floyd. So let me be really clear. I decided to focus the rest of my career on mental health, and particularly with a focus on Black men 2 years ago, before we've seen any of these events. And I have ran around the country begging people to listen to me, begging them to acknowledge a problem. And the data was there. Like, there was no doubt that the data was there. But I am ashamed to admit that people did not want to talk about it. And so if they didn't want, with me, with a fully loaded proposal, deck, data, journal articles to back up what I'm saying, interviews, testimony, if they weren't willing to validate that, like, we should not be surprised that Black men don't have the language yet to talk about their mental health, because up until now, society has not been willing to acknowledge our pain associated with just moving through life on a day-to-day basis. In fact, that when we've even tried to acknowledge that there's this tension that I feel just walking down the street, people discounted it. If people said, oh, I get nervous when I see a police car, they discounted it. Now we know it, like, we've known it to be true, but I think there's more of an acceptance of it now. And so I think, Munson, I would say I certainly agree with you, but I think, like, we all, Black men, need some space to come into this new moment of society being to acknowledge like where we fit in society and how we have been treated.
Always long, always long. Dr. Janet Taylor asked me what my 9th book would be, and it's the Black Emotional Ecosystem. Mm-hmm. And so when we talk about, I talk about 12 steps because I want people to know where you can go at least process and find a process, a place, people that are constantly helping broken people put pieces back together. And there are Black people who, through some self-care, peer caring, you can actually find people who are at least going to talk about the emotions of acceptance. For most Black men, that might start there, just accepting yourself. I mean, at the end of the day, you need to accept the fact that you are who you are. You're in this circumstance in where you are. To get beyond where you are, you have to accept exactly where you are. And that's in any 12-step program. I tweeted the other day, I said, every human needs maintenance every day.
Absolutely.
And so the fact, once you are in a oppressive, systematic, historical, abusive relationship with an entire society, it's like having a car wreck every day. Because they swear that it's my imagination, but you know, I was on a Zoom call the other day and it's supposed to be diversity. They set it up. They hadn't spent any money with us. They hadn't advertised. It was 8 of them. It was 3 of us. So they still got more people on call that I have for less than $50,000. And then, you know, I was slow to get on the call. My personnel was on the call. And all of a sudden, my 3 people, I could see all 3 of my people on the call. Dr. Taylor, it was 8 of them. Mm-hmm. And the guy leading the call said, my camera broke. And so now in my mind, I'm thinking, but your phone ain't broke and you can get on this Zoom call with your phone, but you're not going to look at me. Mm-hmm. I'm never going to know what you look like. Mm-hmm. And then everybody else watched him lynch me in his mind. And I'm just playing this tape. And somebody paid you and is paying you to disrespect me by not coming on the camera. Mm-hmm. And it's a Fortune 100 company. And they paid them not to come on the camera and look at 4 other Black people. Mm-hmm. But that's my imagination. I shouldn't have feelings of wanting to be respected. So I understand the tragedy, because it's like a play that won't stop. And the characters keep changing, but the attitudes in the system doesn't. You know, can't have kumbaya when the suffering is new. Every day it's a new move. It's a new oppression. So literally, I'm saying to all of us, we've got 8 minutes. So how can we manage this stress, this mental stress during this moment in a cultural fashion? What 2 tools would you give people to manage their stress? And I'll start with you, only if you want to.
Yes, I can start. Now, I go back to what you said. I love the concept of your next book about the ecosystem. And if you think about an ecosystem, we are our own microsystem, like we start with us. So number 1 is to be aware of the stress when you feel that, be aware of the microaggressions, like you said, that you felt, and then understand we have the choice not to internalize it, but to rise above it, not in a way to deny it, but to use it as a strength. So the next time it's like Teflon and rolls off, and so that we can use our energy to fight for what makes us better. And a lot of times, I mean, that disrespect happens, but sometimes we can't waste the energy trying to convert somebody to our side. So I'd say the first is to recognize it. And the second is to find examples where you have risen above it. If you don't have examples in your own life, I mean, there's a lot of books about Black people who, you know, Frederick Douglass, who taught himself how to read, right? When a white man said he couldn't do that. You know, certainly we have Malcolm X. I mean, there are a lot of, for 400 years, we've been pulling oppression is not new. But what has been lost sometimes is the what people had to do to overcome. So I'd say recognize it, The other part is to understand that when you are stressed, you have to have balance, which gets back to eating right, exercising, enough sleep. So when you're stressed, you have to find that balance to work out, get sleep, positive thoughts, and be supported by people who support you. And there, you can always find one person who supports you.
I love that, because sleep is so important.
It's so important.
It is so important. I mean, 7 hours minimum. It is so important. I mean, I would say 7 minimum. Anybody else, you want to be irritable, raise your blood pressure, have a stroke, stop sleeping.
Gain weight, I mean, sleep is key.
Heal. You can't heal if you don't sleep. Kevin, you want to give us at least 2 or 3 to help us during this moment to kind of manage our stress?
So, Dr. Taylor really said, I typically in settings like this, I have 5 things that I stress that people can do to improve their mental health. And Dr. Taylor mentioned many of them in her words tonight. Number 1 is quality relationships. Munson, the soliloquy that you gave, if we don't have someone in our life who we can have an honest conversation like that, we're in trouble. Also, it's been said in exercise, we should be exercising. Our bodies are designed to move. 8 hours of sleep, nobody gets any award for saying they only need 4 hours of sleep. That's not true. The brain needs the time to process the thoughts of the day, to clean up the memories and file them in the right place, to disconnect the emotional connection from the memories so you can file them away to use them properly. We need to spend time outdoors, literally take your shoes off, put your feet on the ground. There's something about your feet hitting the ground that improves your mental health. And then the 5th thing is to cook with real food. Literally, you should be chopping up your vegetables, and your hands should be you need to wash your hands because you're literally, handling the food in that way. These 5 things are all evidence-based, proven ways to improve your mental health. And it's been said by many people tonight, but I'm just calling them out as 5 things people can do.
Well, those are 5 KPIs. I appreciate you finally got to my number and put out there that literally they could use. And because I always want my community to take something away. And I think if you're not preparing food during the pandemic, you've missed a huge opportunity to enjoy what it is to chef, to find space in your mind to feed your soul, and to save some money. Dr. Ugo.
So I'm going to go in the opposite direction of what you would expect. I'm not going to talk about diet or sleep because I feel like we've covered those. When you asked that question, I think 2 things came to mind. One is just a sense that of the seasonality of life. I think oftentimes as we're walking through life, temporarily, sequentially, second by second, day by day, our sense is that where we are is where we're going to be. That's what life is. But oftentimes, if you look back in through your journals, through the calendar years, you remember, oh yeah, in 2012, I thought this, and this was a big concern, and I never thought I'd overcome this. But 2 years later, I popped out of that, or a year later, I popped out of that. I think understanding that life comes to us in seasons is a powerful one. No matter how incapacitated you may feel in your current moment, depressed, under the gun, the day will shine again. The night will pass, the day will come again. And so, when we screen for depression in medicine, one thing we look for is a sense of hope. Is there a chance that tomorrow might be better? And I think just mentally recognizing that is a powerful one. And secondly, along with that, I would say, we are physical beings, we are mental beings, but we're also spiritual beings. I think that sometimes you do need to turn off the TV. Sometimes you have enough data, you understand where we are. I personally have not been able to bring myself to watch George Floyd's video. I get it from talking to people. I understand exactly what happened. I've read transcripts, but I don't want to let that additional trauma into my soul. And I think sometimes you just need to turn off the TV and to start feeding yourself from a spiritual source. As a Christian, for me, that's the Bible. And for me, I find that when I start my day and my seasons plugged into God and plugged into God's view of me, that allows me to have a view of myself that sometimes the world around me doesn't offer, but allows me to go out with renewed passion and to do what I do to help my family and to help others as a doctor and just as a Black man.
Well, I'd like to thank all of you for coming tonight to Health IQ, obviously powered by ARP. I think everything you said, but I was hanging out with a friend of mine, Maya Angelou, and she in common, and I'd never wanted to interview her, but they said I had 30 minutes, and by the time I got to interview, they said I had 2 questions. And so Maya's in the room, and I dapped up Common, told him he was doing a great job, he and the president. And then I looked at Maya, and she started to flirt with me and tell me how handsome I was. And I had this crazy suit on, and it was a Saturday, and had no idea I was going to meet her. And so by the time I got there, they said I had 1 question. And she's chatting me up, but I can't get a question. They said, I said, well, if you were to talk to all Black men at one time, what would you tell us? She looked at me, and she was breathing on some oxygen, and she said, I would tell them to forgive themselves, for they and their women have been taken from them, and they can't do anything about it. I think there's a lot that has been taken from our community by the society that we cannot replace and we cannot erase. But you must forgive yourself and move on. So the principle of acceptance plays there, and forgiveness, the spiritual principle, plays there as well. So I'll end on that. Thank you all. Thank you, ARP. And thank you, my community, and these great set of doctors for allowing us to understand that mental health and maintenance is what we all must do. I'm Munson Steed, and you have been tuned in to Health IQ. See you next week. Thank you.
Thank you.
Thank you.